Hello, everyone. This is Kevin Leong from New York City Emergency Management. I want to thank everyone for joining. Ed, you have the floor.
Oh, thank you, Kevin. The purpose, emergency preparedness for older adults in a COVID-19 world is a virtual preparedness panel presentation for older adults. The presentation will include speakers from the New York City Department of Health and Mental Hygiene, the New York City Department for the Aging, and older adults technology services, better known as OATS. We're fortunate in that our commissioner has joined us today. So at this time, I'm going to ask Commissioner Criswell to make some opening remarks.
Thanks, Edward. And let me just confirm by somebody raising their hand, you guys can hear me, right?
Yes.
All right, awesome. Well, good afternoon, everybody. I'm really excited to be part of this again. I've been fortunate to participate in several of these virtual National Preparedness Month events. And while this year does look quite a bit different than our National Preparedness Months of years past, it's really amazing how we're still able to bring people together and get out some critical information. And today we're going to discuss and share information that's really important about preparedness activities for older adults. And as we saw even through the COVID-19 pandemic, those that are most vulnerable to COVID-19 are also the ones that are most vulnerable to many of our other disasters. And so I believe the information that you're going to hear today is really going to be valuable and help improve the general preparedness for all New Yorkers across the city. And so again, today we're going to discuss those proactive steps that you can take to prepare for flu season during COVID-19. We will also learn about the Department for the Aging's many programs that they are offering for older adults and older New Yorkers. And we will also hear about how technology has been leveraged to help older New Yorkers, and we will hear to help older adults maintain stability during the pandemic itself. And so again, we find ourselves in very unique times through this recovery from COVID-19. And as we continue to prepare for coastal storms, we went through heat and we're going to move into winter. And I think the information that you're going to hear today is going to be really valuable. We're really fortunate to have three amazing partners for today's presentation. I'm excited to recognize Fiona Adams, the Associate Director at the Older Adults Technology Services, Ben Strong, Senior Director at the Department for the Aging, and Dr. Dee Ray, Senior Analyst, Risk and Analytics at the Department of Health and Mental Hygiene. I want to thank all of you for your participation today. And Ed Powell, an Individual Preparedness Coordinator at New York City Emergency Management, is going to be our moderator today, as he has for several of these virtual events. So thank you, Ed, and the rest of my team. And Ed, I'll turn it back over to you.
Thank you so much, Commissioner. Our first speaker, our first panelist today to present will be Dr. Dee. Dr. Dee.
Hi, everyone. Thank you so much for having me. I'm going to be very brief because I think I'm just going to give a little bit of context to the excellent presentations from my colleagues at OATS and at the Department for the Aging. And I think we had a slide. There we go. So I just want to start out by giving everyone just a little bit of an update on COVID, and for all New Yorkers and especially older New Yorkers, we have a core 4 set of standard precautions that are really our best armaments against preventing transmission of COVID-19. And those are staying home when sick, maintaining a physical distance from others, wearing a face covering whenever you're around others, and then, of course, washing your hands frequently and maintaining good hand hygiene. And I think that this is a point in time where that is, and this is a point in time where that's more important than perhaps it ever has been in the whole pandemic. And that's because we are at a point where we're starting to see a small uptick in cases in different places in the city. We haven't overall citywide transitioned to a point where we're calling it a second wave or whatever you'd like to call it. But there are indications that we will see an increase in cases in the coming months. And so what does this mean for older adults? I think that really brings the emergency preparedness conversation back into play, because now is the time, if you haven't already, to focus on emergency preparedness. And my colleagues will talk about that in much more detail, but I'm just going to highlight a couple of pieces of guidance that we have at the health department that I encourage you, and we will put the link to the health department website in the chat, and I think we can share documents on email lists, etc. But we have several pieces of guidance, but we have guidance for older New Yorkers who live at home. We have guidance for providers, and some of preparedness involves like this constant, washing your hands, staying at home when sick, etc. But some of it also includes your routine care. Right. And so that means stocking up on your medications in case you are in a situation where it's difficult to get them. I also want to talk about mental health, right? And I think my colleagues will discuss that a little bit more, but we do have some guidance on our website around the isolation that comes with COVID-19 and how that can impact you and how to lessen that impact. I think we've talked about, the commissioner talked about different emergencies that happen at the same time. And even though the seasonal flu is not an epidemic, I think that, the flu doesn't go away just because COVID is here. And so and we can answer questions about this if you guys are interested. But it is especially important to get your flu vaccine this year. Contact your provider. There are specific formulations for older adults, and then I think we'll hear a little bit more about some transportation resources available for medical care and the other city resources that are available to help stay safe at home. I also want to just introduce you guys briefly to my colleague, Dr. Achala Talati, who is here and will be supporting me in answering your questions. She is actually our liaison to the Department for the Aging and has a lot of excellent information for older adults and about city policies and care for older adults in New York. Thank you guys so much.
Thank you, Dr. Didi. And our next speaker will be Ben Strong, who is Senior Director at New York City Department for the Aging. Ben?
Hi, Ed. I'm sorry about that. I believe it'll be Fiona Adams. We had to change up.
Okay. My apologies. Fiona is Associate Director at Older Adults Technology Services. Fiona?
Hi, everyone. Good afternoon. So happy to be here with you today. I think I see a few familiar names on the line from some of our partner organizations. So it's great to see you all here today. So I'm going to talk a little bit about what we're doing and how we've become even more relevant during this time. We can go ahead and move on to the next slide. So I am with Older Adults Technology Services. And while it may seem that we're an organization that just focuses on technology, we actually think of ourselves as a social impact organization. We are really about changing the face of aging, and we're using technology in order to do that. We've been doing it since 2004. We got started in a basement in Bed-Stuy, and 16 years later, we have just grown and, like I said, really taken center stage during this time when technology really is so much more important than it ever has been before. When we are in person, We would typically do multi-week courses in multiple languages, small group settings at senior centers and libraries and different community organizations. And we design our courses specifically for older adults. So we keep in mind how older adults learn, which would be different from younger people. So really keeping that in mind in our program design, and also making sure that we're focused on all the up-to-date technology. We want older adults to be a part of this technology boom that's been happening. So really in touch with, you know, whatever new devices may be coming out. And as I mentioned, because we are a social impact organization, we really focus on different areas of people's lives. So all of our technology training would be in areas including health, social, creative, financial, and advocacy. So I'll talk a little bit more about that going forward. If we can go to the next slide. So we started right here in New York City in Bed-Stuy, like I mentioned, and we have a location in Chelsea, which is, I believe, maybe the first and only tech-driven senior center. But now we also have expanded across the country to other locations on the West Coast, down in Florida, in Texas. So our footprint is definitely expanding. So this is where we have in-person, or historically, I should say, where we've had in-person classes and we have centers. But if we go on to the next slide, I can talk a little bit about how, you know, COVID-19 forced us to, and we are grateful actually that COVID-19 forced us to pivot our programming to virtual delivery. If we can go on to the next slide. So since mid-March, I remember the last day that I was sitting in Chelsea at our center and we went home, and that's the last time. I think it was March 16th or March 15th that I was last at our Senior Planet Center in Chelsea. And then since then, we've been doing virtual programming. I'm so thankful that because we do have that foundation in technology, that we were able to quickly pivot to offer our programming online. So that very next week after we all went home, we got set up and transitioned all of our courses to, I wouldn't say all of them, quite a few of our courses to online delivery since then. And I think these numbers aren't even totally updated, but we've had almost 800 programs. You know, we've gone far beyond the participants who we've seen at our in-person classes. So we've now reached at least 40,000 participants, and almost half of them have never even been to any of our in-person programs. So the pandemic really helped us to reach a lot more people, which is great because that means that more people are taking advantage of technology, more older adults in particular, and that means that they're also more connected because we offer all of our classes through Zoom so that people can see each other and they can talk and they can feel that they're still a part of the community. And we can see in the results, because we do surveys after all of our classes, and looking at some of the results here, you see 86% of people said that they felt more connected to the world around them because of participation in our program. 78% said that they felt more confident connecting with friends and family online. 82% felt better equipped to find resources online, and 81% felt less alone. That's huge. You know, we really like to say that we are physically distancing and not socially distancing, because we encourage our participants to really stay connected by coming onto our programming and really not just coming to learn and to take advantage of the programs, but to get to know each other. So people have now formed friendships that they may not have otherwise because they've been coming to our classes and seeing familiar faces over the last 6 months. And I can personally speak to the fact that people have actually become families. If we go on to the next slide. This is an example of some of the programming that we offer. So like so many people who work at nonprofits, you know, I wear a couple different hats. And so I lead our health and wellness program, and I have a full lineup of fitness classes that I offer, as well as health lectures and, you know, touching on nutrition and mental health and physical fitness, as I mentioned. So there's a full roster of classes that we're offering online. I personally attend many of our fitness classes. And like I said, we've had people who started exercising with us back in March, and they're now telling us that even though they've been stuck at home, they've lost weight, they're so much happier, they actually feel that they're in a better place because they've been able to connect, not just with us, of course, but with all the people who are joining. So this morning stretch class that we have as an example here, we have almost 300 seniors who join us almost every morning for this class. And it's gotten to the point where if someone isn't there, you know, the other participants will say, hey, have you heard from Jeffrey lately? I don't know that we've seen Jeffrey. And that's exactly what we wanted to accomplish with these classes, because again, it's not about social distancing, it's about physical distancing while still maintaining that social connection. So we're really thankful that we've been able to take that community that we would have within our centers and transition that online. If we go on to the next slide. So the other hat that I wear is that I manage a program called Connected Mycha. Through this program, there were about 10,000 seniors who live in Mycha housing developments who received free internet-connected tablets through the city. This was incredibly important, again, because if someone is at home alone and they don't have a device, and they're not familiar with how to use that device, that just reinforces that isolation. And so thankfully, the city came together with DFDA and Mycha and T-Mobile to distribute these 10,000 tablets. And then OATS, through our Senior Planet program, we're supporting the program by providing free training and social engagement. So we have a hotline where folks can call in to learn about their devices. We have online classes, which, you know, we really commend the older adults who have participated, because for some of them, they've never touched technology. You know, we have testimonials from folks who have said, I've never even owned a computer, and now here I am, I have this tablet, I'm participating in Zoom classes, I'm talking to my family in England and Jamaica and all across the world, and that's what we want to hear. You know, this photo that I have here is from a graduation, a virtual graduation ceremony that we held after a 5-week class. And these folks, I mean, if I could invite all of you to a graduation, I would, because it is the most heartwarming experience to hear people talk about how much happier they are having the tablet and being able to connect not just with their classmates, but now with their families and their friends, and being able to just be more independent now that they're able to use the technology. I have to just read this quote on the slide here. This tablet is making me a new person. I was living by myself. I was disconnected from the world and lonely. But now with this tablet, I've learned so many things, and it has made me so happy and busy. I feel connected again. I mean, we couldn't have written that better ourselves. You know, that is absolutely our objective, and it's amazing to see that we're delivering on that. We can go on to the next slide. So I wanted to talk a little bit about some of the resources that are available on our website. So this is actually a section that we've called COVID-19 Resources, because we just thought about the different things that older adults would need as they are stuck at home a little bit more now. And so we put together a range of resources, you know, from the very basics to a little bit more advanced. So we have video tutorials that are on downloading apps, just connecting to the internet. You know, we have low cost Wi-Fi providers listed there. We have Zoom instructions, because that platform has been so familiar. So, I mean, I won't read it all to you, but we put together a whole section on the tech basics. And then as you see here, we also have a hotline that folks can call into, because not everybody, you know, not everybody's that tech savvy, and they need somebody to still walk their hands through the process. And so we also have our really skilled trainers available who can do that in at least 3 languages. So if we go on to the next slide. We also have what we're calling these stuck at home guides. So we're not going out as much. How do you get your groceries delivered? How do you do your banking? How do you just participate in some entertainment? You know, it's not just about doing the basics. You want to have fun while you're at home. Just because you may be at home alone doesn't mean that you still can't have a good time. So the virtual entertainment section is actually a listing of different activities that are happening around New York City that we put this guide together so that folks can go online and see things that are available to them. So it's not just about taking part in our programming that we offer, but people have opportunities to learn about other things that are happening in the city here. And there are other guides as well that you can get to in that section, but I just wanted to go through a few of them here. On to the next slide. So again, the theme, I think, of this entire talk so far that I've been giving is all about staying connected. We're physically distancing, but a virtual social life doesn't have to be scaled back. So we have a book club that we do. People can chime in and comment on the website about different movies and different books. And then we've also just, again, cultivated other events that people can participate in while they are at home. So, just in summary, while again, we are a technology organization, we really understand the impact of social isolation, particularly amongst older adults. And we understand even more now the importance of technology in helping to minimize that isolation. So many people who may not have been willing to try technology before, they're now in a position where they have to. And we're happy about that, because technology is here to stay, and some older adults may be resistant. And this pandemic actually really opened people up to the thought of using technology. And one thing that we commonly hear once people give it a try is that there are two things that we commonly hear. They're so much more confident, and they feel like they've entered a whole new world. And so we're really thankful for that. And we're just inviting more and more adults into this whole new world that we have here. And we look forward to working with them. So I think that's about it for me. We can move on.
Thank you so much, Fiona. Just an amazing presentation. Ben Strong will be our next speaker from the Department for the Aging. Ben?
Ed, thanks so much. It's been an absolute pleasure working with you over the last year on these events. So I'm going to go ahead and give a little bit of background on the Department for the Aging, otherwise known as DFTA. So DFTA is committed to helping an estimated 1.64 million older adults in New York City live in their homes and their communities. We know that this is a community that's growing over the next 10 to 20 years. We partner with hundreds of community-based organizations to provide services through older adult centers, otherwise known as senior centers, naturally occurring retirement centers, otherwise known as NORCs, case management and home care agencies, home delivered meal programs, mental health and friendly visiting programs. And so in-house, the agency also has a senior employment services unit, a caregiver resource center, elderly crime victims resource center, grandparent resource center, foster grandparent program, military program, and volunteer resource center. And so our core mission is to eliminate ageism and ensure the dignity and quality of life of diverse older adults, and also to provide safe and inclusive services for older New Yorkers, regardless of immigration status. And part of that mission, and absolutely part of our priority during the pandemic, is to ensure the health and safety of our providers, our constituents, as well as our agency staff. We also want to ensure continuity of our services for older adults, and I'm going to touch base on this a little later in the presentation. The Department for the Aging also maintains an Office of Emergency Preparedness and Response, which is a team dedicated to the emergency preparedness of our agency, provider network, as well as our clients. Kevin, we'll go to the next slide. So, speak briefly on the importance of emergency preparedness. It's critical that older adults take standard emergency preparedness measures seriously, particularly in light of the pandemic, which has had a devastating impact on the city's older adult population, which is really the most adversely impacted population by age. And there's always this possibility of concurrent emergencies, as we saw this past summer, particularly with heat emergencies, but of course, also in anticipation of coastal storm emergencies, fires and building evacuations. We want to remain prepared because it's not just a pandemic that could impact older New Yorkers. It's these other emergencies. As we move into winter weather season, we want to remain cognizant that winter weather could impede services and access to grocery stores or direct meal delivery systems such as Get Food or home delivered meal programs. And it's not just about the older New Yorker, it's also about their families and their friends. The more you're prepared, the less stress that those family and friends are. And of course, in hand with that, this also helps care providers and reduces stress for the larger and broader emergency response network. So I'm going to take a few moments to go over preparedness steps for older adults and what they can do to prepare for emergencies in the COVID-19 environment. So very critical is having and sustaining an emergency support network. And this is at least 2 people, usually family members, friends, neighbors. This could be caregivers, coworkers, or members of a community organization or group. And really this is someone to communicate with during an emergency. They keep in touch with you during an emergency and check on your status. And often they know where you live, and they may have spare keys to your apartment. And they may also understand specific medical needs, such as medication or disabilities that may impair your ability to react during an emergency. And on this, you may want them to have copies of important documentations, particularly those related to the medication that you may or may not take. Emergency supplies is also a critical element to being prepared. This is typically in the form of a go bag or emergency kit. It's a collection of standard items you would want to have if you had to leave in a hurry. This should contain non-perishable food, equipment such as flashlights, phone charger, backup medical equipment and first aid kits, names and information of healthcare providers, copies of important documents such as your health insurance, that could be Medicare, Medicaid cards, photo IDs, proof of address, marriage and birth certificates, copies of credit cards, as well as cash on hand. If you're relying on self-sustaining equipment, you want to keep backup batteries and oxygen tanks. You may also want to sign up to alert your utility company if you are a life-sustaining equipment customer. And therefore, utility companies can notify you of a potential power outage, and they'll call you during a power outage to check on you. If you utilize a wheelchair or scooter, you want to keep a tire repair kit. If you have a pet, you want to make sure that you have extra supplies and medications available if necessary for your pet. You want to keep extra personal protective equipment on hand, such as masks and gloves. You may very well want to add this to your go bag. And absolutely, not only with your go bag, but at home, you want to keep emergency food supplies on hand, particularly during this pandemic. And you want to keep at least a week's worth of extra food. And this should include non-perishable items and bottled water. If applicable, you should become familiar with your home care or other provider emergency plans. This way you know how they may react, how they may reach out to you during an emergency. And you also want to ensure that you have direct connection with your pharmacist, that you can access medicine if needed, and have a backup as well. We'll go to the next slide. So keeping safe during the pandemic, I want to highlight the core four, which is wearing a mask, social distancing, and I think Fiona put it best. It's really about physical distancing rather than actual social distancing. You want to keep and connect with your care providers, your friends, your family. You want to wash your hands consistently whenever you're out and about. And if you feel like you're symptomatic, if you're concerned about having been infected, you want to get tested. And generally speaking, for public and home safety precautions, you should really be only going out when you need to. You want to limit the guests that you might have over at your home and ensure that they're taking precautions, and if necessary, ask them if they're doing so. Next slide. So DIFTA remains dedicated to continuing services for older adults during the pandemic. When older adult centers closed in March, DIFTA and its network providers worked to convert its in-person services to a system of delivery and virtual programming. Programs transition to virtual or telephone-based services. And these services include senior center social engagement, friendly visiting, fitness classes and programs, geriatric mental health, caregiver support, case management, and health insurance information and counseling webinars. DIFTA is also working to keep older adults socially engaged. From mid-March to August, DIFTA and its community-based partners made over 1 million calls to clients to limit social isolation and address other needs. DIFTA views social isolation as a concurrent pandemic during the COVID-19 pandemic. Therefore, we continue to make these calls on week about 10,000. These calls have been very essential, not only to check in on older adults, but to provide referrals to services, and that includes, as mentioned, friendly visiting, elder abuse programs, and mental health services that could be provided as they adjust to the realities of the pandemic. Another way we're combating social isolation is through social virtual programs. We have 170 senior center providers offering virtual programs. This includes Zumba classes, arts and crafts workshops, clubs, comedy hour, music programs. And all the virtual programs have had more than 37,000 attendees. And as mentioned by Fiona earlier, the city delivered over 10,000 free tablets equipped with Wi-Fi to older public housing residents, and this was in conjunction with OATS. Next slide. And these are some critical resources to reach out to if you're interested in DIFTA's programs, if you're interested in learning more about older adult emergency preparedness. You can reach out to Aging Connect online or through 311. The number for Aging Connect is 212-AGING-NYC. DIFTA has a website with an emergency preparedness page, which also links to emergency management's Make Your Plan for Seniors page, which is also an excellent resource that's going to go over all the preparedness items that I mentioned earlier. And Ed, I think that's it.
Well, thank you, Ben. And incidentally, all of the emergency preparedness information that Ben shared with us can be had in publications that are provided by way of New York City Emergency Management, and in particular, the My Emergency Plan booklet. So visit nyc.gov/ready New York. I'll repeat that once again, nyc.gov/ready New York, or Ready NY. Once again, nyc.gov/ready, READY NY. Okay, at this point, we're going to take some questions. And I believe that Kevin has been sort of accumulating a lot of questions. So Kev, what do we have?
Thanks, Ed. So the first question is from Deborah. Her question is, if older adults have phones that are not sophisticated enough to upload apps like Zoom, what do you recommend for them and their need to socialize?
Oh, I can start there.
Awesome.
We actually have some older adults who join our classes by phone. So even if they're not able to see, even our fitness classes, you know, we make sure that the instructions are clear enough so that they can follow along by phone. You know, it's not the exact same experience, but it definitely helps folks to stay connected when they can just join by phone. So it definitely is an option.
Great. Thank you so much, Fiona. The next question is from Teresa Chang. Her question is Oath still helping seniors to get free internet service? A client of mine received for the free iPad, but has no internet service.
So we were not actually, I mentioned a resource on our website where we can direct folks to low-cost internet service. However, the free internet service was specifically for the 10,000 residents who receive the LG tablets. And as far as I know, you know, there isn't another round of tablets that will be offered at this point.
Great. Thank you so much. The other question is from Eric and Hillary. Will this presentation be archived so I can share with a retired group I moderate? I will answer that question. Yes, this presentation will be is recorded, and if you do want the slides, please email us at readyny@oem.nyc.gov. I will also put that down into the chat box for everyone to see. Just give us a couple days, and this presentation will be online. The entire presentation will be there for you to view on YouTube, and you could go over to our webpage at nyc.gov/N as in Nancy, P as in Peter, and M as in Mary, NPM, and you will be able to receive the YouTube link to it. The next question is from, I'm sorry if I get this name wrong, Hanat Ibrahim, and the question is, how can a community-based organization partner with the agencies to help the older members?
What kind of organization, I guess, would be my question to that. But that's very interesting. And I guess what types of services are they looking to provide? Okay,
great. So Hana, if you want to go further in depth about your question, just type it to me and the panelists, and we'll try our best to answer it. Going on to the next question. This is from Deborah again. She is asking that how do other seniors who are not in the Mycha project get tablets or other modes of technology?
Yeah, it's a really good question. And, you know, we've been hosting bi-weekly workshops for service providers, and it's something that comes up every single time. And we recognize that the technology access is a problem, which is why we're so thankful that the city did do this initiative to distribute this first round of tablets. I honestly don't have a good answer for you. You know, I'm glad to hear that there are more and more programs where this is happening. You know, I heard of another senior center that was able to get some funding to access just 50 iPads for their members. And so now we're offering some training. So I wish I had a better answer for you, but I don't. The technology access, it is still a challenge. Very grateful though that we are in a city where that's recognized and there are programs happening to try to get that technology in the hands of older adults. Tifta, Ben, I don't know if you have any thoughts on any additional programs. that could be available.
And this is for Wi-Fi, and this is also for tablets.
Yeah.
Yeah. Not at this time, right? So we had the program that we collaborated with over the summer for the 10,000. But I think it's important for folks to stay in touch with DFTA, in touch with Aging Connect, if they have questions about that. It's good in the sense that we get to hear that there's perhaps a growing demand for a particular thing or service. Therefore, we can relay that onto our agency and our agency partners.
Great. Thanks so much, Ben. So there are a few of you guys and ladies that are asking about the email, saying that I went a little too fast. So I'm just going to go to the next slide. The presentation or webinar is not over yet, but just so everyone can see our email, which is readyny@oem.nyc.gov. If you have any other requests for PowerPoints, or if you want some other stuff from us, please give that email. A ring, and we'll be able to answer that as fast as possible or provide you with the right resources. So thank you for those answers, Fiona and Ben. The next one we have is again from Teresa Chang. Is there any in-person help from OATS for people with their technology?
At this point, all of our help would be virtual. So we have the one-on-one phone coaching that we do, and then we have the virtual classes.
Great. Thank you so much, Fiona. The next one is from Diane Davis. She said that if we are urged to stay in as much as possible, what is the purpose of having a go bag?
Because of those concurrent emergencies, if you have a fire in your building, if there's a partial building collapse, you may have to evacuate immediately. It's good to have that information on hand. If there's another no notice type of emergency, such as a terrorist attack, anything that could push you out of your home, it's very important to have that information, all those emergency supplies, if necessary, to take with you and take with you on a moment's notice.
Great. Thank you so much, Ben. Another question I got to me is, I think this is for NYC Health. Are there still testing available in New York City? And I assume that is for COVID-19. Dr. Didi, or anyone from DOHMH?
Sorry about that. What was the question again?
Yes, sorry. The question is, are there still testing available in New York City? One, I assume that is there still free testing available in New York City? And I assume also is pertaining to COVID-19.
Yes, of course. So, so COVID testing should be, is mostly free almost everywhere. So you shouldn't really be charged for the COVID test itself. So any healthcare facility, any of the public healthcare facilities through health and hospitals, any of the testing sites that they've set up, and any of the city health departments testing sites are all completely free of charge. If you go to a private urgent care, we can't certify that, even though they probably won't charge you for the test, they may charge you for other things surrounding the test, like the protective equipment that the staff have to wear to give the test. So, if you are concerned about the test being free, I would really urge you to go to one of our testing sites. And if you go to nyc.gov/COVID test, you can find a testing site that's near you. We also, there are a couple other advantages to that. The city and health and hospitals do a strategy called pooling of test results. And so because of that, the results are often faster. We also offer rapid testing if you're really concerned about getting your result quickly. The rapid tests aren't good for travel. however. I think that the other thing is that you'll see we're trying to partner some of our flu vaccination outreach with COVID test outreach. And so it might be a nice opportunity to get both of them in one shot. The other thing I just want to mention for this call is that we've heard a lot of concerns, in addition to cost, about the information that's collected at the testing site, and especially that your COVID test results or other information can be used to negatively impact your immigration status. And we will not ask you about your immigration status at all. The sites often ask for insurance and ID if you want to provide it, but it is absolutely not required. You can walk in without insurance ID and get a test at the city's testing sites.
Awesome. Thank you so much, Dr. Dede. That was great information. Moving on, we have a question from Mariah Washington. Her question is, Fiona, now that you are virtual, are you serving older adults who do not live in your program states?
We are, yeah, because we have folks joining and they're telling their family members and their friends. And so we are actually getting people from all across the country now. Even a few people will join us from, Europe or Spain. We've had drop-ins from lots of different places.
Wow, that's awesome. Perfect. That's
Yeah.
great. Thank you so much, Fiona. Another question is from Gia. The question is there a go bag going to be distributed on Staten Island, please? I could take that question. So I'm not sure if there will be a go bag being distributed. If go bags are being distributed on Staten Island, they might in your private, in your own non-community based organization that serves your area. But for New York City Emergency Management, we do have a social media initiative that that you can give us an email about 2 or 3 pictures and have a description on it. And if you're chosen to be featured on our social media pages, we will contact you to email you a go bag. What I would recommend is to go on our YouTube page or ask for or try to attend one of our presentations, and we will show you how to make a go bag and really personalize it to your specific needs and use. So there are different ways to get it, but from New York City Emergency Management, there is no mass distribution of go bags at the moment. I know that before the pandemic happened, New York State did go to each borough to provide a presentation and provide people who attend that presentation a go bag stuffed with a lot of goodies. I'm not sure if they're continuing that at the moment, but if you want to shoot us an email at readyny@oem.nyc.gov, I could get a better answer for you, Gia. Sorry, I can't have a completely full answer for you, but thank you so much for that question. The next question is from, The next question is from Valatina Jones. Her question is, are there classes on avoiding telephone fraud?
So Senior Planner, we do have classes on staying safe online, which does touch on telephone fraud as well. So yeah, I went through some of the sections on our website. I would definitely encourage folks to check out seniorplanet.org. It can even be a little bit overwhelming with all the information that's there, but I would suggest starting in that COVID-19 section. You'll find a lot of good resources there.
Great, thank you so much. There is another question. This is from an anonymous attendee, very mysterious, but this is for Ben, I believe, is when will senior centers reopen?
That's an excellent question. And so the answer there is we very much want them to reopen. It's really depends on when it is safe and it is feasible to reopen them. So this is absolutely an ongoing conversation we've had with other city agencies, with our senior center providers. We can't wait for them to reopen. But until it is deemed safe enough, I think we're gonna have to wait on that answer.
Great. Thank you so much, Ben. Another question is, how old is a senior? Is it 60 plus, 62 plus, 65 plus? Yeah, whoever wants to take that.
So I think that answer varies. For olds, we're 60 and above.
For DIFTA, it's 60 and above.
I think for us, and this is also, and Dr. Talati can comment as well, but I think ours, in terms of COVID, is stemming from different guidance, and it's really based on where the age cutoffs were in the studies that they talk about. But for us, for COVID, it's 65. I do want to say that it doesn't mean that, you know, you're 64 and 364 days, right? And then it doesn't mean that your risk radically changes when you hit that number. It's just really, you know, they have to make a practical cutoff there.
Great. Thank you so much. So another question I have, and I think after this question, we could take maybe one more. This is from David Cow. Which agency regulates the senior centers in New York City? Is it DIFTA, DOHMH? And how is social distancing, max capacities, et cetera, and PPE compliance monitored?
So for senior centers that are registered with the city, it is the Department for the Aging. And Kevin, you had a second part to that question?
Yeah, so the second part is how social distancing, I think when David means when the senior centers are open, how social distancing, max capacities, et cetera, and PPE compliance monitored, and that is when senior centers reopen eventually.
I think the answer to that is for a later time when we actually develop a codified and certified reopen plan for senior centers. Certainly the monitoring of and ensuring